name's Jesse Chason with Lisa Blanchard as the host of Airing Addiction.
I share often my journey started on this campus. Got sober as a client here, just like you.
I really do see phenomenal change.
Always hope. I've seen situations that on the surface look impossible become possible.
Doing this podcast is to share those recovery stories, be honest about what the challenges are and have some real conversations, but kind of share that out on the airwaves.
Welcome, everybody, to today's episode of Airing Addiction. It is October. We're kind of fresh from all of our fantastic episodes in Recovery Month and pretty energized. And I'm really, really excited about today's episode. Often we hear from folks that they don't really understand what treatment looks like. It feels like a bit of a black box, especially to family members or those who haven't accessed treatment before. So we really decided to take the opportunity for this episode to demystify some of that and talk a little bit about what you can expect in substance use treatment, what that looks like. So I'm really excited. We've got a fantastic panel, some of the best people that I know on today, and I'm going to turn it over to Jesse to let him introduce you all.
Thanks, Lisa. Good morning, everybody. And I second that. Some of the best people that I know, too. So who are these people that we have here today? I know them very well, but to introduce them to everyone that's going to listen to this, we have Marybeth Adams. She's the Executive Director of Inpatient Services for New England Recovery Center. We have Sarah Stewart. She's the Program Director at New England Recovery Center Detox and Residential Program. And we also have Alexandria Supernor. I hope I said that right, Alex. Clinical Supervisor at the New England Recovery Center Detox. Good morning, everybody. How are we doing?
Great. Good morning. Thanks for having us.
Awesome. Thanks for being here. So kind of like Lisa was saying, just to, demystify the black box of treatment. Obviously, we're very familiar with treatment, and to all those that are listening, I've probably said this before, but I know these three very well from working with them at New England Recovery Center for years. So this is a bit of a special episode, even more so for me. So why don't we kick off with whoever would like to discuss just a little bit about NERC. What is NERC? Why do we call it NERC? What can somebody expect if they're looking for admissions to NERC or admissions for a loved one? I'll throw that out there to anybody that would like to answer it.
All right. I think I'll start. So New England Recovery Center is very near and dear to our hearts, all of us on this panel. We are an inpatient detox and residential facility. We have 84 beds. We did expand over the last couple of years, so we have 36-bed co-ed detox and a 48-bed CSS program, so clinical stabilization services. So you can complete your medical detox with us at NERC and then transition onto our residential facility for more of a clinical approach and transition back into your life and attaining all the clinical services that you need to maintain recovery. So really proud of our program, proud of the staff. The admissions process is where it all begins. People are calling into treatment and, it's crisis. People need to know that they're going to get a warm person on the phone. They're going to be, approached in a way that's, nurturing and understanding and, also really immediate too. People call and, you need to get, in immediately because, there's a very short window of time. Sometimes it takes a lot to pick up the phone and say, hey, I need help today. It starts with that process. It starts with our amazing admissions team. They do the first phone call. Oftentimes we're talking to families, we're talking to courts, we're talking to outside agencies, therapists, other programs. And then, we facilitate that admission pretty immediate based on medical necessity and clinical need.
So I wonder if we could talk a little bit about how important it is. You said a few things that strike me about our process. Immediate Right. Warm, which kind of strikes me as like warm, caring, supportive, and family involvement. Can you talk to me a little bit about kind of, why it's so important to respond immediately when somebody says, okay, I think I'm ready to start treatment, or can you tell me more about how I do an admission, or my loved one is with me and they're ready to go into treatment? Like, why do we need to respond so quickly?
So, Sarah, did you want to speak to that?
Sure. It's really important because when that person's ready, it's fight or flight for them as well. So if they can't get a bed, that hopelessness kicks in, that thought process of going down the rabbit hole again of, well, it's just easier for me to continue using. And they get into that mindset and that pattern of the addictive behavior. So if we don't strike when the iron's hot, I know that's one of MB's phrases. If we don't strike when the iron's hot, then we really could lose that person from getting them in and, trying to help them. So that's why it's really important. And, to include the family in that. Sometimes we just have loved ones calling in for this person, and just, walking them through the process, I think, is a really important piece to this as well, so that they understand what's going to happen when the patient arrives, or just, walking them through having this person struggling in front of them and how to help them is really important, so that we can get them into treatment when we can.
Thanks, Sarah. And as everything is connected, we've had Maureen Cavanaugh on this podcast more than once. And for those of you that are listening or watching this, Maureen had helped start a family support group called Fast Magnolia for her own lived experience with a loved one struggling with addiction and now found recovery. And Spectrum partnered with Maureen to help create Fast Magnolia for Spectrum, which we run every Wednesday at 6. Yep. I always forget if it's 6 or 7. 6 o'clock. And if anyone's interested in that, they can just email magnolia@spectrumhealthsystems.org. As you can tell, I'm pretty passionate about the family work. Full disclosure to anyone listening, I did work for New England Recovery Center as the family engagement specialist for a number of years. And I am very interested in talking about that, not only from my own experience, but, to anyone that would like to answer, what is the, what can a family member expect if they call? What, sort of steps do they walk through with their loved one? I remember what it's like when I was there. However, that's been a couple of years now, so I'm sure things change. What happens now for family?
So we really believe family involvement is imperative, to the whole process here for treatment. In family, sometimes it's not often. Often it's not, a biological connect. It can just be a natural support. It can be, a friend. So we need to be involving all these natural supports in order to maintain success when people leave our program. So our family program here is really strong. As soon as Allie can speak more to the clinical involvement at the beginning. So right when our clients come into the detox program, we ask them, who do you have for support? Who do you identify as your family? Can we connect with them? There's so much to that process that can assist in the healing process here. And, if we're not helping the family outside of our program, through education, through understanding of the disease, we're kind of missing a piece here, and we really feel strongly that this is important. So I'll let Allie speak a little bit to that, as to that connection, beginning at the detox.
Yeah, absolutely. Thank you, Marybeth. I second what you said. It all starts with that first initial call with the person we're working with. So with the patient in treatment, having them be on board and calling that family member or that loved one, letting them know that they arrived at NERC safely. So maybe they didn't transport them to treatment. So kind of letting them know, we've got them, they're here, they're safe, they're working with our medical team for that stabilization. And then how can we help, support them through that process? So can they provide us any history? They love and know the person, the patient the best. So what can they provide us for tips for treatment? And how best can we involve that family member or that loved one involved in their treatment. Of course, all guided by the patient. But for this behavior change, like Marybeth said, it's really important to have supports through the process. And so we're connecting throughout the treatment process. And, should they remain with us on campus to go to the residential program, that's where we can kind of do a deeper dive family session as well. Getting them to see the program, meeting with a clinician or a case manager to kind of help guide a conversation about discharge and making sure that the plan is supportive and involves the family member. We also do groups for our patients in treatment on the impact of their substance use disorder that has impacted their family, so they can kind of take the perspective of their loved one as well to kind of touch on both pieces.
And so, that what strikes me about that is, even in treatment, we care so much about our patients when they come in the door, but we have them for days or weeks, right? Depending on which level of care they're in and how long they stay and what they need and what they're willing to do. But their family and their natural supports have them always, right? So the more that we can do work in supporting those connections and maybe repair and education and understanding of the process of addiction and recovery, the more likely that person's going to be successful when they leave. Right? Because often folks are going right back to the environment that they were in before they entered treatment, or they, might be going on to a different environment, but still have those connections that can either be supportive or less supportive to their recovery process.
Exactly. You bring up a really good point. And, so much of that transition back into the community and back into their family is, educating them on what's a healthy relationship and what isn't a healthy relationship. A lot of our clients come into treatment and they're not even aware that the system that they've been existing in for all these years, really, really need some insight and some, education and, maybe transitioning to another level of care would be better for them in their recovery rather than returning to that same environment. So, aftercare is such a major part of our program here. We have our people for, a short period of time, some longer than others, depending on medical necessity and their clinical need. But, we start the aftercare process, really when they start with us upon the first few days, because we want to learn, is their family, in a good place for them to return where they're not going to be experiencing all these triggers. And we know that addiction is dual diagnosis, everything is, tied into mental health. We have to make sure that, they're receiving all their mental health care and they're working on that healing process, concurrently with transitioning back into the community. So it's our job to really make sure that people are set up for success. And a lot of times it's not returning home. It's, working with our collateral resources, in the community. We have so many, connections, locally and then in the New England area. And, we really work to make sure people are transitioned to the next best appropriate placement from us. So, you can look at this period of time as being such a short period of time. It's like, can there really be a lot of work that gets done in such a short period of time? But absolutely. A lot of people, don't even realize they've never been in therapy before. They've never experienced what it's like to get out those negative thinking, patterns with anybody. And they experience that here with us, with our clinical team and, and with their peers. A lot of our staff are in recovery as well. So, we have that, connection as well. So there's just a lot that they receive in the walls here that they can mirror when they leave. It's like, geez, that actually made me feel better to talk about that to Allie today, and, okay, so let's set you up with somebody on the outside as well so you can continue that process. So much work can get done within the short period of time that people are here with us.
Yeah. And thanks, Marybeth, for touching on the aftercare piece and just the crucial, I think there's a misnomer that people, because it's such a foreign concept to most, people think they drop their loved one off in treatment or they go to treatment for themselves and then they spend, a fixed amount of time, whatever many days or weeks or months that may be. And then it's like, okay, I'm cured, I'm fixed, I'm going to walk out and go back to normal life. normal, whatever that is, right? And I heard you say that aftercare starts pretty much right away, and I've also heard it put like, if I fail to plan, I plan to fail. Because if I, how many times does someone come in and say, oh, I'm good, I'm just going to come here for this and then leave, and like, there's a crucial piece missing there where, well, what are you leaving to? Right? What's the plan when you leave? And it's just so comforting as someone in recovery to know that, if somebody goes to New England Recovery Center, ultimately it is up to the patient, but there's plenty of options for aftercare. There's plenty of options for, what's the next step? What's 3 steps after that, right? Let's take this time to map out the next however many, weeks or months that the patient wishes to. And I guess just to dispel further any misnomer about aftercare, because some people that are listening to this could still not know what that exactly entails. We talked about therapy. We talked about the clinical benefit of engaging in therapy inpatient and the benefit of finding a therapist outpatient. I guess what other options for aftercare are there available to someone who comes to New England Recovery Center?
So I think sometimes the reason it can be so overwhelming is because there's so many options for aftercare. We can, look into sober housing, halfway houses, IOPs, which are the intensive outpatient programs, PHPs, which are the partial hospitalization programs, some with housing, some without housing. Then again, like you said, you have the outpatient psychiatry, outpatient counseling, maybe outpatient family engagement. There's just so many options. There's also RSS programs and TSS programs. There's really a whole world of aftercare out there that can be so hard to navigate. And if you've never been through it, you don't know what half those acronyms stand for. And I think one of the strengths at NERC is we really do our due diligence and follow up with a lot of the programs that we refer out to and build rapport and relationships. So we know they're getting the same care there that they are with us, and that we do warm handoffs, and that not just our clinical team, but our business development team can help follow up with that patient further and check in on them and continue to help them beyond NERC. And that's one thing that I absolutely love about our program is once you walk out the doors, you're not done with us. We're still going to follow up and continue with you and make sure you're okay. And there's nothing better than hearing from clients down the road that, hey, I love that you sent me to Green Mountain or, other programs that we work with. And it was great. It was a huge success, because that's what we want for our patients. We want to make sure that they're in good hands moving forward, because the aftercare world can be pretty scary to navigate, especially if they've never gone through this.
It's really not one size fits all, right? There's not one pathway that makes the most sense for every person, right? Depending on, their length of use, the substances that they're using, their family situation, their financial situation, what they're willing and able to do, right? All of those things factor into what aftercare looks like. There's not, and I think a lot of programs, this is one of the things I do think sets New England Recovery Center apart a bit, is that a lot of programs have kind of a designated path. Everybody enters this front door and exits this door and follows this path. And we very much are individualized, right? So you could enter through the door and to a detoxification program. You could enter through the door into our stabilization program. If you don't need detoxification, there's not like a forced entry in any door. We have, 16 locations in the state for outpatient support. So we can really even keep people connected to New England Recovery Center and Spectrum, but it's not one path in and one path out, right? That it really is the individual person. And so tied to that, I'd love to talk a little bit about some of the work we've been doing about, ensuring that we're offering medication for addiction treatment as an option so that people don't have to choose, do I want an inpatient bed or do I want a longer term outpatient medication, right? Like you really can do both of those things at once. And this is a real opportunity to start that conversation while you're at New England Recovery Center.
Yeah, our case management team talks and our clinician team talks with the patients in treatment about medications for substance use disorders. Tell me what you know about it. What are some myths that you might hear that we could kind of debunk for you? Here's some information sheets. Let's grab nursing and have them really have this conversation from a medical perspective. What medication might make sense for you depending on the substance that you're using. If you're set on beginning medications for substance use disorders, what location could we set you up with? Where are you living? Do you have transportation? Kind of just going through that whole process, and not just asking once, like asking throughout their treatment, to make sure that they're making informed decisions. We also facilitate a group on that weekly, just to kind of get the patients thinking about like, oh, maybe this could be an option for me, and starting that right at the detoxification process.
That's excellent, because the repeated conversation is often what's helpful, right? And somebody comes in the door feeling great, right? So making decisions on day one about whether you're going to start a medication or not sometimes isn't helpful. And there is a lot of stigma, even in the recovery environment, about how these medications work, but you really can't deny the evidence base for them, right? And so it's about, just like any other treatment, what I love about this approach is we're just doing exactly what you would do if, God forbid, you were diagnosed with cancer, right? You go and sit with a provider and they say, here are your treatment options. Here's the evidence base. Here's the impacts to you and your life. And let's make a decision together, right? Like, we don't often do that, I think, at times in addiction treatment, where, people just kind of follow a path that they see someone else follow, or follow a path that somebody else did. And it might not be the right path. Like, everybody's journey is very different. And so, I really appreciate that at New England Recovery Center, that, we're really open to all, pathways of recovery.
Yeah. And sort of to go off what Lisa just said, and I agree with that, there is no one size fits all cookie cutter approach to this. What works for somebody may not work exactly for the next person, but there's more similarities than differences. And we've even had NERC alumni on this podcast as guests to tell their story of lived experience and, sort of where they're at now. If anything comes to mind for all three of you, what are some of the more unique approaches, or a unique approach that you've observed a patient take that maybe, somebody wouldn't think of for their long-term recovery? Or, I can think of a few, again, from the people we've had on for guests, but I'm just curious to see if anything comes to mind recently as far as, alternative treatments or just a unique pathway to recovery.
Well, I can just think of, just coming from the medical standpoint, Lisa, you were speaking to it, and, how we have to treat this as the physical component to this. Substance use disorder has evolved so much, and New England Recovery Center and Spectrum have gone with the evolution of, what's happening outside in the outside world. And it's just become so escalated and, a level that, those of us who've been working in the field for a long time, it's people who are coming into treatment are in total crisis, physically, emotionally, and they need stabilization. So treating that physical piece, if people are not feeling physically well, they're not going to be able to touch upon what's really continuing their relapse cycle. So, addressing that, Allie was mentioning from the beginning, and then, when they transition to our CSS program, everybody receives a psychiatric evaluation. So that's so important, because then we can take a look at, what needs to be treated, just looking at sleep hygiene. If you're not sleeping, everything looks so much worse, and people have gone their entire lives without sleeping well. So, asking those questions, like, what's your sleep like? We need to, and some people aren't even aware of it. They're just so used to it. Once, we have that psychiatric evaluation and try to help people feel better and, treat their mental health, the curtain's lifted a lot of times, and we're really able to touch upon what's keeping people sick. So I don't know if that answers your question, Jesse, but I just think it's so important to touch upon both pieces to that, while they're here in our time. So, just the dual diagnosis piece of it is so important.
Marybeth, I can't stress enough how important that is, right? And how sometimes I think that's another way that can, set us apart of it, is that we really are looking at that whole person. And it's of course, the recovery work is important. Of course, the actual process for detoxification is important. But what keeps people out of treatment and keeps people, away from connection to treatment is that fear about how I'm going to feel. Right. That fear of what if I feel withdrawal? What if I feel sick? Or that fear of how do I manage these emotions when they come up? Because I haven't been managing these emotions when they come up for a very long time because I've been treating them with substances. Mm-hmm. And so how do we support teaching new ways to manage, whether it's depressed mood or anxiety or a lack of sleep, all of those things. Like, we really need to treat that whole person. And that's our real opportunity, while we focus on stabilization. We can plant the seeds in a detoxification admission for sure, and maybe build some aftercare around that. But we have more time to really, practice and do evaluations and really support folks when they're in stabilization.
We have such a great opportunity to actually see the lack of coping skills play out in our program. So when we see it play out and people, want to leave prematurely, say, or they need to talk through their anxiety, or they need to talk about this grief they experienced and loss, and they want to run from that, we have such a great opportunity here to help people through it. And it's like then they feel relief. They got past it without having to turn to substances. And it's like this incredible experience for them that they're able to get through that pain, experience it, talk it through with us, or their peers here in treatment, and get to the other side of it. And they're able to see that they're able to do that without turning to, the maladaptive means that they're using outside of treatment. So there's just so many opportunities while they're here at NERC.
And it makes me think a little bit about trauma-informed care and really, being trauma-informed in our processes, because, all behavior meets a need. And so, substances certainly have met a need. They work really well, right, for a lot of things, and they cause lots of damage and cause lots of chaos along the way. But there are real reasons why people are using substances. Of course, the way that addiction works in the brain and how deep those pathways can grow. But often it's really to manage really some severe trauma and severe emotional pain. And we have to recognize that as treating providers, right? And I think that that's just such an important piece to focus on, being trauma informed and helping people see that there's other coping skills that you can practice and try in a safe environment, and see how they support you differently than substances do.
Yeah. And, to know too, from the provider perspective, Marybeth said that this was a great opportunity to, engage with our patients when these lack of coping skills come up, and to know from the provider perspective that there's a reason why this behavior is present. Oftentimes it's knee-jerk reaction. I just want to leave treatment. Well, why do you want to leave treatment? Chances are there's that need that wasn't met, like Lisa had talked about, right? Every behavior meets a need. So I guess that leads me into my question of, from the provider perspective, I certainly have my favorite memories of working at NERC for years. I'd love to hear from any one of you about what do you like about working for NERC. If someone's listening to this, we've had plenty of podcasts about, working in the field. And if someone's listening to this and thinking about getting a job at New England Recovery Center, what would you tell them that makes NERC stand out?
How much time do we have, Jesse? Because we could go on for quite some time. No, but in all seriousness, I think one of the best things about NERC working here, so as a personal perspective, is just the support that comes from working here. You're not an island on your own. You have a whole team behind you, working with you, supporting you, whether you're brand new to the field or, have been here for 10 years, there's always something to learn and grow in this, role. And with New England Recovery specifically, you can feel the compassion when you walk in the door. You can feel the support that you have here, for clients and for staff. And I think that that's a huge part of it, because this is hard work that we do every day. And to be able to have your peers and colleagues to lean on and to help you through it is huge.
That's great, Sarah. Allie, how about you? What keeps you at New England Recovery Center?
Yeah, I want to echo much of what Sarah said. I do agree that it's the staff. I also think it's the leadership. You aren't faced with making decisions alone. It can be really scary. And I think about some of our staff members who might be working on like second shift and third shift and how that can feel really scary and alone. But we do have incredible leadership here at NERC, as well as like on-call systems and, team approach. So you don't feel like you're ever left with really big decisions alone. And as well as just our interdisciplinary like teamwork approach, where clinical isn't just working in clinical, like we're working alongside the RSs, we're working alongside our admission liaisons and our nurses to kind of provide the best care that we can. And it feels really great to be a part of that team.
Allie. Marybeth, as the leader of this ship, you want to share why you're still here?
There's many reasons, like Sarah says, but, I just believe in this work so much. I've just been so passionate about this work for such a long time. And I really believe that we're able to do what's necessary to help people know that there's hope in this treatment, and there's really good people out there who understand and who care and who will take care of you and take care of your family. I'm able to do what I've always, wanted to do here. And that's really have the team that I have. Allie and Sarah, fantastic. I wouldn't be able to do this without them. They're just partners in this work with me. And, we're all like-minded. We all feel so strongly about the clinical piece to this. We understand, again, this is such a dual diagnosis disease. And, we work collaboratively with nursing and psychiatry. And it's not people aren't working in separate ways. We're all working together to treat the person as an individual. And this is developed, like it's at the place that I'm just so proud of. And, I would send my family here. I don't know how else to say it other than that. I would. And we just work as a team, and we all have kind of the same ideals. We certainly laugh a lot too. That helps. Yeah. Jesse, Sarah, Allie, we definitely, we laugh with our clients a lot too. I mean, yes, this is serious, and it's, we have to get you on the right treatment plan, but, we add a lot of humor to it, and, our clients teach us so much. I learn something every day when I come to work here. So.
Yeah. Well, that couldn't be said better, right? I mean, I have sent my family to the Recovery Center, and so I think that speaks volumes. And what I love to hear from all of you is, I can be in charge of all of the clinical services for the organization, and I can help write great curriculum and a great clinical plan. But if we don't have the passionate staff that can take those evidence-based practices and take that material and then translate it to the patient experience, then we don't have anything. And I think that's one of the strengths that we have at Spectrum New England Recovery Center, is that we can hold both things. We can hold the evidence base and the constant evolution and changing. We're always changing our curriculum. We're pilot testing a new depression curriculum right now that we just released this past week. They were constantly evolving the clinical services that we're offering. We're constantly evolving our medical procedures, but with the staff that are ready to do that with us, and that are ready to make those changes and put the person at the center of absolutely everything that we do. And I think it's worthwhile to note there's some wonderful treatment providers out there. We've got a lot of respect, a lot of great partnerships with other providers that we work at on aftercare with. But I think there's something about our over 50 years of experience in this field. And there's something about New England Recovery Center, although we often support individuals that are either commercially insured or self-pay, we are a nonprofit organization. And we treat absolutely everybody. Programs, the spectrum look very similar to our programs at New England Recovery Center. And it does not matter where you are or who you are or what you bring to us. We see the person, behind all of that.
And Lisa, I have not sent my family to New England Recovery Center or Spectrum, but as I've said on here a million times, and I think it's in the intro, I've been to Spectrum, and I can echo certainly everything you just said about treating the whole person, treating the person with compassion and care. For myself, I remember walking through that door for the first time and having no other experience to compare it to, and having a lot of fear and anxiety and doubt. And honestly, it kept me away from treatment for years because I just didn't know what to expect, and I settled for less with what my life was at the current time. And walking through that door and immediately being met with the staff and someone who I could, use as a sounding board or, answering questions. And I had a million of them. And the unique perspective I have today is I can see it from both sides because, some of those staff are still with us at Spectrum Health Systems, and I get to talk to them, years later, and also have the lived experience from the treatment provider side. And, as we are wrapping up here, I would be remiss if I didn't mention that to anyone thinking about treatment or anyone seeking treatment or, thinking about for a loved one's treatment, New England Recovery Center and Spectrum Health Systems is a safe place where, yes, we have some of the greatest curriculum. I think I may be biased, but some of the greatest curriculum and clinical treatment plans. And, we certainly offer group therapy and individual therapy and the family sessions once somebody's stabilized at our CSS. However, some of the most impactful conversations I've had with patients happen in the hallway, happen outside on the back patio, happen just organically when somebody is ready. You can't schedule those appointments, if you will. That's just, way too many variables that come into that. So I'd love to hear from anyone that has, anything recent or anything that stuck with you about a patient experience or, something that a patient has said to you that has stuck with you sort of as motivation to do this or, anything like that.
I have an example that's sticking with me right now, and it was actually pretty recent. We had a patient who was ready to transition up to our Ferris building, and our detox and CSS program are in two different buildings. Transitions can be very scary for our clients, and this one particular client had a really tough time with it. She wasn't feeling ready in that moment, having a breakdown. I brought her in my office, listened to her story, and I totally understood why. Again, going back to Lisa with the trauma-informed care, she had a lot of trauma with transitions prior to this. So this triggered that for her, and her and I were able to talk through it and process through it. And I saw her last week up at our residential program, and she pulled me aside and she said, I just want to say thank you for listening. And I'm so excited. I really actually want to go to the RP program because I want to continue with this campus. I want to continue with Spectrum and NERC because of how much that conversation helped. And like you said, Jesse, sometimes it's not a scheduled thing. Sometimes it's actually in the moment of crisis where we can have that conversation with clients and really help and support them. And that is why we come back every day and help our patients do this work, because again, she was at risk for walking out the door and leaving, but she chose to sit with me. She chose to share her story and make that progress. And it was just really empowering to see and to be part of that.
It's awesome.
I think we hear a continuous theme too, Jesse, from our clients here. It's like the staff here are different. They reach, our clients on a different level, and, they genuinely, can feel the sincerity and the level of compassion that they haven't felt somewhere else. I've heard that quite frequently too. So I have to give credit to the staff here, and also the environment is really comfortable. If the environment isn't safe and feels warm and welcoming, then that's the first impression. So you walk in and you have that nurturing feel, but also the staff really back that up with their one-on-one kind of interaction.
Marybeth, one thing I'd like to add to that, which really I think you show with your leadership, but really all of our staff do, is that we know that recovery journeys are not often, you enter treatment and you exit into recovery. Now, I think Jesse has a great story where that's kind of what happened for you, right? We walk into the residential program and there we go. Got, a lot of great work there, but often it's a bumpier road. Often there's a lot of return to use and, the plans that were laid just didn't end up working out. And folks need to come back to us. And one of the things that I think also sets us apart is that there's no shame or judgment in that, right? We would actually rather you come back to us. We call people and say, how are you? Do you need us again? Do you want to come back? It's okay if you come back, right? This is part of the disease of addiction. It's not for everybody, right? Relapse does not have to, return to use does not have to be part of it, but it certainly can be. And you didn't lose all of that work from that last admission. Let's start now, not starting over, but starting from experience. And let's make this admission differently. And we're here to support you, right? There's no shame or guilt for that your recovery plan didn't work out. That's okay. Come back in. And we'll do that as many times as somebody needs.
Absolutely. And like you just said, building upon that, it's so hard for people to call and say, I need help again. And it's like making it so normal and part of the process. And, this isn't a setback. We're just building from that last step. We as providers need to look at that and see what more we need to add to your recovery story. We need to help you in a way that we haven't helped you before, and we take partnership in that, let's look at it, what was missing, and we just figure out the missing link and then go from there. So nobody should ever feel shame in coming back. We welcome everybody back and their family.
Most definitely. And kind of to bring it all full circle, I remember a conversation with the patient that happened organically at NERC Detox where this exact subject came up. The person was there for, the multiple times and really beating himself up about, I'm back again and this is what I lost this time. And, I love humor too. I love laughter. And, I said something about, well, exactly what Lisa said, because I like that, you're not starting over, you're starting from experience. And then I like to say it's not like Men in Black with the little red dot, you look at it and you forget everything, but you're really starting back on that foundation. And even though return to use hasn't been part of my story, I still give everyone credit and really, I'm actually in awe of their courage for coming back. Because that fear that I talked about that kept me away from treatment for years, like I didn't even try to come back. I just stayed away. So in a way, if anyone's listening to this and thinking, I don't want to come back again and face that and see the people and all that, like you can come back and we welcome you back. And just the fact that you're thinking about that is actually showing change and courage and resilience and all these things that we build up in recovery because we don't have to stay away. You don't have to stay out there for, any longer than you have without a solution like I did. I tend to do things the hard way sometimes. So don't be like me in that and, come back. We welcome you back with open arms. And, that particular patient I've since talked to and, let's just say that was the last time he was in treatment and now he's doing well. So
fabulous.
That's so fantastic. So we're coming up on the end of the podcast here. I welcome any last words from anyone, but I do want to just echo that message that Jesse just shared, right? So you've heard from some wonderful, compassionate people today. If you, would like to meet Allie and Sarah and Marybeth in person, we are here and we are ready for you. Just give us a call. Anything else you all would like to add?
Just want to say thank you for having us. We're not like promotional people. We were kind of nervous for something like this, but thank you for giving us the platform to brag about NERC and to brag about our staff and, the work that we do. So just wanted to say thank you.
yeah, we definitely appreciate this. It gives us an opportunity to, really talk about what happens on a day-to-day basis at our program. And, we welcome you to give us a call, and, we will take good care of you from the beginning till the end.
And I love the opportunity to, kind of let you all brag on our behalf as well. I'm so proud of the work that you all do. We hear about it so often when we have the amount of times that we've shared a recovery story on this podcast. And I had no idea. A couple of times we've known, because maybe Marybeth, you suggested a wonderful recovery story, but really there have been so many, stories of recovery that started at Spectrum New England Recovery Center or have touched New England Recovery Center that I had no idea about starting the conversation. And I consistently hear from those stories. That's really my favorite time to hear it directly from folks who have been touched by our services, what you all do every day. And I know sometimes it's hard and you don't always hear back. So this is just another thank you for everything that you do.
Thank you, Lisa.
Well, thank you, everyone. This has been really special. Like Lisa said, if you are interested in treatment, if for a loved one or yourself, please reach out. New England Recovery Center and Spectrum Health Systems would love to help. Thank you, everyone, for following Airing Addiction. And for more, I'm not a promotional person either, Allie, but this is my one promotional sentence on this, that for more Airing Addiction, please like and subscribe, and we will be back soon with another episode.
And if you do need to reach New England Recovery Center, you can call 1-877-MY-REHAB.
Thanks, Lisa. Thanks, everybody.
Thanks, Josie.
Thanks, Marybeth, Sarah, and Allie.